Hello, my name is Mandy. Today I'm a student nurse, and today I am going to be doing a head-to-toe physical assessment. But first, let me wash my hands. And can you tell me your name and date of birth, please?
Janet Gino, February 6, 1964.
Okay, thank you. And I've been told that the nurse tech has already came in into your vital signs.
Yes.
So I'm just going to jump right in. First, I'm going to inspect and palpate the scalp, look for any lesions or depressions or any abnormalities. And now I am going to palpate your sinuses. Tell me if you feel any tenderness, your maxillary sinus, and your frontal sinus. And now I am going to look at your eyes. Your conjunctiva is pink and moist. Your sclera is white and moist. And now I am going to look at your pupils. And your pupils are equal, round, and reactive to light. Now I'm going to test accommodation. Look at my light. Then look at the wall behind me. Look back at my light. And your eyes accommodate symmetrically. And we have already tested cranial nerve number 2, which is the optic nerve on the Snellen's chart. And her vision was 20/20. And now I'm going to check cranial nerve 3, 4, and 6. Your oculomotor, trochlear, and your abducens. Can you follow my pen for me? Thank you. And that's testing cranial nerves 3, 4, and 6, your oculomotor, trochlear, and your abducens. Now I am going to inspect the nose. The external structure is fine. There's no lesions or abnormalities, and it's symmetric on the face. Can you tilt your head back, please? And I am going to now look at the mucous membrane. It's pink and moist, and the septum is not deviated. And now I'm going to do a patency test. Sniff. Okay, there's no blockage. And can you flare your nostrils for me? Thank you. Okay, and now I'm going to check the mouth. Usually I would palpate the lips, but I'm not going to do that today. From observing the outside, they're pink and moist and not cracked. Can you open for me, please? The mucous membrane is pink and moist, no sign of jaundice or any lesions. The gums are pink and moist, no signs of any lesions. The teeth look fine, there's not any caries. Can you go ah?
Ah.
And the uvula is not deviated. And I was checking cranial nerve number 10, the vagus. Can you stick your tongue out and move from left to right? That's checking cranial nerve number 12, the hypoglossal nerve. And now I'll check cranial nerve number 7, the facial nerve. And can you smile for me? Can you puff out your cheeks? Thank you. And now I'm going to check cranial nerve number 5, the trigeminal nerve. Close your eyes, and I'm going to touch your face. Tell me, say now when you feel it.
Now.
Good. Now I am going to inspect and palpate the ears. I'm going to pull on the auricles. Tell me if you feel any soreness or tenderness. And push on the tragus. Good. And now I'm going to perform cranial nerve number 8, the acoustic nerve, also known as the auditory nerve. Can you plug one ear for me, please? And repeat after me. 3, 4, 5.
3, 4, 5.
7, 1, 8.
7, 1, 8.
Thank you. And now I am going to test cranial nerve number 11, your spinal accessory nerve. Can you push up on my shoulder? On my hands. Thank you. Push. Thank you. Push. Thank you. And now I am going to palpate the trachea. The trachea is midline with the rest of the body. And inspect the thyroid. There's no inflammation of the thyroid. And now I'm going to palpate for a carotid artery, but not at the same time. And now I am going to auscultate the carotid artery for a bruit. A bruit is blockage within the carotid artery, and it sounds like a swishing sound. But she has no bruit, so that's good. And now I am going to palpate the thoracic cavity. The temperature is consistent, the skin is consistent, but then with the rest of the body, there's no lesions. Now I'm going to auscultate the lung fields. When you auscultate for the lung fields, you listen for any wheezing or bronchi or crackles. In which I hear no wheezing, bronchi, or crackles. And now I am going to check respiratory excursion. Breathe in, please. Exhale. And the lungs ascend and descend symmetrically. Now I am going to feel for any thrills or heaves. And there are no thrills or heaves. And now I am going to auscultate the valves of the heart. On the right of the sternum, second intercostal space is the aortic. Left of the sternum, second intercostal space is the pulmonic. Third intercostal space is the bridge point. Fourth intercostal is the tricuspid. And fifth intercostal is the mitral. And then now I'm going to auscultate for the apical pulse, also known as the PMI. The PMI is the point of maximal impulse. And the PMI is located mid-clavicular between the fourth and fifth intercostal places. And that's a really strong pulse. Now I am going to inspect the upper extremity. I'm going to check for skin temperature, turgor, and there's no tinting, so she's not dehydrated. I'm going to check her capillary refills, and her capillary refill within 3 seconds, so that's normal. I'm going to check her radial pulse and her brachial pulse. And those are symmetrically bilateral. Now I am going to check her range of motion. Can you repeat after me, please? Abduction.
Abduction.
Flexion. Extension. Adduction. Supination. Pronation. And now I am going to, there are no logic sensation. Okay, close your eyes, please. This is sharp, and this is dull.
Sharp. Dull.
Good, now I'm going to do the other line.
Sharp. Dull.
Good. And now I am going to test the strength of her joints. Okay. Can you push down on my hands? Good. Push up. Good. And now I'm going to check her deep tendon reflexes. The radial pulse. Not your arm. The bicep. And then the tricep. And you would do that to both arms. now, also I forgot to mention, but the heart is located between the second and fifth intercostal space. And now, can you turn around, please? I'm gonna go to the posterior thorax. I'm gonna inspect her back. There's no signs of scoliosis or kyphosis, so that's good. Now I'm gonna check respiratory excursion. Can you inhale, exhale? And my hands moved in and out symmetrically, so that's good. And now I'm going to auscultate the lung fields. And again, like the front side, when you are auscultating the posterior thorax, you also listen for wheezing, bronchi, and crackles. And you also check laterally. Good. There was no reason, no wheezing, bronchi, or crackles. And now, can you come back and lay down, please? And now I'm going to inspect the abdominal cavity. First, I'm gonna auscultate in all four quadrants, starting with the right lower quadrant and going clockwise to the right upper quadrant, left upper quadrant, left lower quadrant. And then each quadrant, the vowel sounds can either be hyperactive, hypoactive, audible, or absent, but to clarify that a vowel sound is absent, you have to listen up to 5 minutes. And now I'm going to palpate in each quadrant, starting at the right lower quadrant. Tell me if you feel any tenderness. Good. And now I am going to move down to the lower extremities. I'm going to palpate for temperature and test for pretibial edema. And so temperature is consistent with the rest of the body, and there's no tenting, so she's not dehydrated. And now I'm going to do a neurologic sensation test. This is sharp and this is dull.
Sharp. Dull. Sharp.
Now I'm doing the same thing to the other leg.
Sharp. Dull. Sharp.
Good. And now I am going to check your range of motion. Okay. This is flexion. And while I'm doing this, I am also feeling for her popliteal pulse, extension, abduction, adduction. And you would do the same thing to the other leg too. And now I am going to check her capillary refills. And they refill within 3 seconds, so that's normal. And now I'm going to check in between her toes for any lesions or cuts or sores, anything like that. And now I'm going to check her dorsalis pedis pulse and her post-tibial pulse. And once they are both bilaterally symmetrical. And can you sit up for me now? Have you ever did oh well, now I'm going to test your deep tendon reflexes. This is the patellar. Here, Achilles. Now I'm going to check your plantar and clonus. And everything is normal. Now, have you ever did a monthly breast exam before?
No.
Well, I suggest that you start and pick a day in a month and pick the same day for the months after. And what you do, you can either do this in the shower or laying down. You put your hand behind your head, but I advise not to do it when you're menstruating. So you can start at your armpit or axillary and go to the tail of Spence and go in a circular motion, palpating, pushing down. Or you can go up and down, or you can start from the nipple and work your way out. And when you get to the nipple, make sure you pinch it for any discharge. And if there's any discharge, then I would recommend that you see your physician for further examination. Do you have any questions for me?